HS 1.2. So as I mentioned, you've got the oral preparatory phase, the oral phase, the pharyngeal phase, and the esophageal phase. And I said that the most complicated of those was the pharyngeal swallow reflex. So now I'm going to talk you through how the whole thing works, the muscles required, and the innervation of those muscles. First of all, let's have a look at some of the anatomy in a bit closer detail. Starting from the mouth, you've got the mouth, you've got the tongue, leading to the oropharynx. Above that, you have the vestibule of the nose, the nasal cavity, and the nasopharynx. The soft palate, the hard palate here, and the soft palate here, called the uvula. Anteriorly, you have the trachea with the epiglottis, and posteriorly, you have the oesophagus with the upper esophageal sphincter, leading down to the gastroesophageal junction. Now let's have a look at the swallow reflex as a whole. So what happens overall? Well, the first thing that happens is the bolus of food reaches the palatoglossal arch of the oropharynx. So the food reaches the back of the mouth. The next thing that happens is to stop the food from going up into the nasopharynx. You close the nasopharynx. How do you close the nasopharynx? Well, as you can see here, the thing that is separating the nasopharynx from the oropharynx is the uvula, the soft palate. So you're going to want to tense and elevate this to prevent the food from going up. And the way you do that is by using tensor polytony, the muscle, and the muscle levator polytony. The clue's in the name. Tensor polytony tenses it, levator polytony lifts it up. So, in terms of innervation, when the bolus of food reaches the palatoglossal arch of the oropharynx, it stimulates the glossopharyngeal nerve, cranial nerve 9. And this results in stimulation of the mandibular branch of the trigeminal, which is CNV3, which stimulates the tensor polytony. And it stimulates the pharyngeal plexus, which is cranial nerves 9 and 10. The pharyngeal plexus, cranial nerves 9 and 10, is pretty important in the swallow reflex because it innervates quite a lot of the muscles required. So what have we done so far? Well, the food has reached the back of the mouth, and then to stop the food from going up into the nasopharynx, you've closed the nasopharynx by tensing and lifting the levator, the soft palate. Once you've closed the nasopharynx, you stop the food from going up into the nasopharynx, the next thing you want to do is pull the pharynx forwards and upwards to the food. And the way you pull the pharynx forward and up is you use the longitudinal muscles of the pharynx, which are the three muscles: stylopharyngeus, going from the styloid process to the pharynx, salpingopharyngeus, and palatopharyngeus. And in terms of innervation, once you've closed the nasopharynx, you then stimulate cranial nerve 9, which is the glossopharyngeal, to stimulate the stylopharyngeus, and the pharyngeal plexus, cranial nerves 9 and 10, to stimulate salpingopharyngeus and palatopharyngeus, these three being the longitudinal muscles of the pharynx, which pulls the pharynx forwards and upwards to the food. So you'll note when you swallow, a lot of the structures in your neck move upwards. That's the pharynx, and the larynx moving forwards and up to the food. And one also thing to note is this: you see this dotted line here going up. When you close the nasopharynx and you pull the pharynx forwards and upwards, it has a side effect. It opens the auditory tube. And what happens is it equalizes the nasopharynx middle ear pressure. So when you're going up in an airplane and your ears are blocked and you force yourself to swallow, you're going to unblock your ear through this method, by equalizing the nasopharynx middle ear pressure, by opening the auditory tube, by closing the nasopharynx and pulling the pharynx forwards and up. The next thing that happens is you want to prevent the food from going back into the mouth and up into the oropharynx. And the way you do this is you use, well, what's in your mouth is the tongue, obviously, right? So you're going to want the tongue to go up and block the oropharynx off once the food's gone past it. And the tongue muscles are the styloglossus and the palatoglossus. styloglossus is innervated by cranial nerve 12, which is the hypoglossal nerve. And palatoglossus is innervated by the pharyngeal plexus, cranial nerve 9 and 10. Another thing to quickly note is that it's a bit of a trick basically. In terms of the swallow reflex, the most important innervation is the pharyngeal plexus, cranial nerves 9 and 10, right? Glossopharyngeal and vagus. And if the muscle has the word stylo in it, then it's innervated by something, it's probably innervated by something else. So the styloglossus, for example, innervated by the hypoglossal nerve, and stylopharyngeus innervated by the glossopharyngeal. So what have we done so far? Well, the food is moved from the back of the mouth. It's reached the back of the mouth. You've closed the nasopharynx. You've pulled the pharynx forwards and upwards, and you've closed off the oropharynx. The next thing that happens is you want to prevent the food from going into the trachea, which is called aspiration. And the way you do this is by covering the trachea with the glottis by making the epiglottis move. And how do you do this? Well, once the oropharynx is closed, then you innervate the larynx using the recurrent laryngeal nerve of cranial nerve 10, the vagus nerve, which goes down, passes up under the aorta, and goes up to the larynx. The recurrent laryngeal nerve of cranial nerve 10 of the vagus innervates all the muscles of the larynx, apart from the cricothyroid. So the epiglottis moves, and the glottis covers the trachea, and also the arytenoids and cricoarytenoids contract, causing true vocal fold closure. And when you've closed the true vocal folds and you've covered the trachea, then you've succeeded in preventing aspiration of food going down the trachea by blocking the trachea. And after you've closed the trachea off, then you want this time not just to pull the pharynx up, but you want to pull the pharynx as well as the larynx up. And the way you do this is by elevating the hyoid bone, using the digastric, which comes from the chin, and the stylohyoid, which comes from the styloid bone, the styloid process of the temporal bone even. And the innervation of this is the cranial nerve, the trigeminal innervates the digastric, and the facial nerve innervates the stylohyoid as well as the digastric. And this elevates the hyoid, causing the pharynx and the larynx to be lifted up. After this, the upper esophageal sphincter relaxes, allowing the food to pass into the esophagus. And then the vagus causes esophageal peristalsis, making the food go down through the esophagus to the lower esophageal junction. And that's the swallow reflex. And one more thing to note is that what causes the pharynx and larynx peristalsis is the constrictor muscles. So we've looked at the longitudinal muscles. The pharynx also has constrictor muscles, and these constrictor muscles, upper, middle, inferior, they contract one by one to cause pharynx peristalsis. Also, looking at a summary of the nerves required, you've got the swallowing center in the medulla, and you've got the trigeminal nerve, 5 glossopharyngeal, vagus, which make up the pharyngeal plexus, and you've got the hypoglossal nerve, cranial nerve 12.